Hello, this is Dr. Dimitrios Kostopoulos, and this is another episode of Precision in Clinical Practice, where you boost profits and patient outcomes with diagnostics. Once a year, there is a major event that takes place. It's called the Leadership Academy of Hands-On Diagnostics. During that event, the members of the Hands-On Diagnostics group get together and they discuss ways to excel and expand their practices, and they share amazing tips of successful actions they have taken. So I put them all, the most successful professionals, I put them all in a panel, and they are sharing ideas that can really make your practice succeed just like that. I grilled them, I asked them the uncomfortable questions that you all want to know, and I hope you enjoy today's episode. Let's listen to that.
And we're going to start with Elena.
So as I mentioned before, I stepped into the Vice President of Operations here at Apex. My key stat is number of lives changed. My target is end of year payroll percentage of GI at 50%. So it's a really exciting step for me. I started as the clinical director of one location, and I'm overseeing now both locations. So I'm still doing a lot of the directorship within both offices, and then I'm stepping into the production side, which is the scary part for me because I don't have a ton of background in that, and so I feel like a sponge, just taking on as much as I can and learning as much as I can from the production side. So I'm also working with the other heads over here that you'll learn a little bit more about with Danah and Leo, and just how all of the different buckets that are within Apex Physical Therapy, how they all contribute, and then I'm helping to kind of oversee all of that. So I help with and we'll go into this a little bit more detail in a little bit, but our meeting rhythms, overseeing them for both offices, our weekly meeting rhythms where we do more of like a lunch and learn, like clinical round setup, and then our training of new therapists and our checklist, like customer excellence checklist is what we call them, and just making sure that our therapists are providing the best care, and not so much with, how are you testing these measurements and how are you progressing these exercises, but at more of a deeper level, like how do you interact with the patient? Do you celebrate a win? Are you giving them a high five? Are what we lovingly call the phrase, are you driving the car with the patient? Do the patient know where you're going within your plan of care? So I'm overseeing all of those pieces. My why, I love what I do. I think I was like one of the unique ones that knew that they wanted to be a physical therapist, like when they were in 8th grade, and stayed true to that all the way through. I love helping patients, and I have a love for helping my team and seeing my teammates grow and be better. I want to be Angie. So that's, I think 7 years ago when I started, we've had great relationship all the way through until now. And I've been really transparent and like, well, I want to be you. Like when you're ready to retire, Angie, I'm here. I'm ready to step in. So we've had a great relationship over the years and just continuing to grow.
All right. So again, I'm Danah. I'm a physical therapist and athletic trainer, and I am our clinical excellence and director of diagnostics. So this role was created for me because I love to teach. I love to coach. I love pioneering for our profession. And it's so cool to be part of a group that recognizes the strengths within each of us. And we're able to kind of build this for each of us. So my target by the end of the year is to have my key stat at 60% of the evaluations receiving diagnostic care. So what we talked about, thank you.
That was great.
So we're going to get there incrementally, but we're making great progress with this in going after what we heard yesterday, which is the behaviors. So rewarding and reviewing and celebrating the wins diagnostically with the clinicians each week, doing clinical rounds, sharing diagnostic wins, professional wins. We kind of go around the table at our huddles and our clinical rounds weekly to do this. We're also doing this by taking students and hosting student nights, trying to get as many young professionals in front of all of these things, because one of the saddest things, someone touched on this earlier, is, these new graduates come out of school and they think they need a fellowship. They think they need a residency. They want this. And I know how much debt they have, and it makes me very sad. So I want to be able to reach these new graduates to say, this is the path. You can make the full-time salary and learn these extra skill sets to make yourself more marketable and also be able to recover from your financial debt faster. So that's my why, is to help the profession.
Leo.
I'm Leo. I am the Director of Prime Services here. Basically, my role is to nurture and grow our innovative services and our self-pay programs. The cool part about that is that we have so many different innovative services here that we can offer our patients daily. I treat a patient and maybe one thing didn't work well for them, dry needling or new fit. We can revert to something else that almost always, will land and stick with that patient. So I think I love that part about my job. The other cool part is that, once they're ending their plan of care, we don't discharge our patients, right? We transition and we advance them to these new programs. So they're still under our tribe, they're still under our building, still under our supervision, which is huge, right? So, in the past, we would discharge our patients with an HEP, and maybe they'll do their stuff, maybe they won't. Most of the time they don't, and then they end up back with the same issue, right, a couple months later. So we're seeing less and less of that now, and I love that. So, and I'm excited to see what kind of programs we can conjure up in the future. So. And of course, target is $120 per visit. Yeah, not my quarter. End of the year target.
To our practice, our goal is to, obviously, as we were talking about, the balance between, you get all these extra certifications and you get all this extra stuff, but then how do you make it up in getting more per visit, as we were just talking about with our presenters? And so we're figuring out a way, Leo at the helm, to make that happen and bring up our reimbursement per visit. Our director of marketing.
Yeah, so my role here is the director of marketing. So I ease the initial evaluations in the door. My target for the year is 60% of our initial evaluations are going to be Prime. Our Prime program is our self-pay program. Prime has a nice ring to it rather than self-pay. It sounds like Prime, your VIP, all that stuff. It sounds better. So it is a daunting task coming. As us starting in 2005. Solely 100% insurance. We were in pretty much over basically every insurance that there was on, and not just the normal ones that of, but also ones that were from up north. So we would be Blue Cross Blue Shield of Florida. We were in network with Blue Cross Blue Shield of New York, and this and that, anywhere around the country. So going from that to what we're targeting this year, but January, we were at 30% in our Fort Myers location, which is awesome. So that's a great start in launching us, towards the end of the year. But what it really does for us is that's the type of patients that we want in the door. So my why, being the head of marketing, is I can control who we're bringing in. I want the people who want to get better. I want the people who care about their lives. They want to, do all the things that our therapist program. I don't want a person that never works out, never eats right, wants to depend on all the meds. The only reason why they're coming to therapy is because their doctor said, I'm not giving you any more meds until you go do therapy for a month. That's not our avatar. We've put in a program now where we've actually, for the first time ever, we're triaging the patients that are coming in the door. So we have people who are prime, they get access to us within 48 hours, 24 hours most times, 48 hours are in the door. If they want to use their insurance, let's say they are one of our avatars, one of our athletes, Sally twisted her ankle last night, the mom's calling, can you get her in? Yes, we can get her in tomorrow. This is our prime, we'll get you in VIP. Well, actually, I want to use my insurance. Oh, okay. Well, and then we have a spiel in place to say, you have access to all of our elite services. She's going to get better faster. This, and that. We can actually do a diagnostic ultrasound to determine the extent of the injury. Sally's mom's still intent on that insurance. Okay, well, we'll take your insurance information, but unfortunately, because of us having to authorize that, it's going to be about 2 weeks before we get you in. Guess what happens now? The mom's thinking, okay, we'll do that program. So it's just a matter of the mindset and how you get in direct, like what, they don't know. We assume that they know, but they don't know until we educate them. And then once they see, oh, you can do imaging and treatment and everything on the first day, and you'll know exactly what's wrong. Heck yeah, the price of that is like, it's priceless. So that's my why. I want to get those people in the door that, are our true avatars, and the people, like, I said, our staff wants to see, so we have a happier staff in general.
So if we look at 2022 versus 2023, when we started creating this ecosystem of champions at the helm of these various areas, because before this, Joe was doing evals, and Joe was kind of doing diagnostics, and Joe was doing kind of all the things and marketing, and I don't know, whatever. And we were kind of a mishmash of, we were just all trying to do everything. Yeah, we were all trying to do everything. So when we look at 2022 versus 2023, our percentage of evals having diagnostics increased from 19% to 32%. Yeah. Interestingly enough, we had almost that same exact growth of the percentage of lives that we were able to change, percentage of visits through our door. Of that percentage, how much of that revenue was in prime or self-pay? Interestingly enough, that also went up 19 to 33% in a 1 year period. With that, I think it's worthwhile to mention some of those higher revenue producing areas. Just again, what our experience has been, if that inspires anything from you guys. But as Leo was saying, our personal training or athletic performance programs that we offer after formal physical therapy, when the skilled part of physical therapy, right, is no longer needed, we don't discharge. What do?
Excel.
We excel, and we go into our aftercare programs. And so we had 38% growth in that last year, and just that program alone generated approximately $134,000 in revenue for the practice. Also, one of our elite and innovative services, as Leo said, is dry needling. This is something that we utilize very frequently. Very much it gives our athletes better, faster, immediate results. Do we save them time with dry needling? Absolutely. Did they get value when they can see under the ultrasound what we're able to show them, and then needle it, and then 2 or 3 sessions later show them under the ultrasound that they have scar tissue, that their tear went from 75% to 25%, to show them that, look at your ankle ligament tear. It's all scar tissue now. You're okay to play. You can play. We're going to tape up your ankle. You can play tomorrow. To have that, it's amazing. But anyways, so just from, again, dry needling, something that we have added to the practice, something under Leo's belt, in revenue last year, that was another $115,000 that we brought in. So again, we talk about declining reimbursements, and we talk about those sort of things. These are areas that, yes, it helps from a reimbursement standpoint, but ultimately, does it change our patient's life? 100%. Does it go through the lens of autonomy, excellence, and innovation? 100%. And are we getting our athletes better, faster by doing this? 100%. So for us, it's a complete win. And since we were just talking about dry needling, I'm going to do a little dry needling plug for a second. So just in case you didn't know.
Yep. Lower body class is next weekend. So far I have one coming if anyone else wants to come join. But I'm privileged to be able to, share the techniques. I love research. I love manual therapy. So dry needling is a win-win in our practice. After Joe's done the dirty work with the EMG, it makes it easy to say, hey, listen, the EMG came back clean. It's myofascial. You need dry needling. You need cupping. Then we're going to follow it up with the new fit. Or if it is radiculopathy, to be able to have those tools to say, yeah, it's your L5. And that's how we're going to know exactly where to dry needle, exactly where to put the new fit pads. So it is it's a grand slam in our practice. And with anyone who is working with, those people either with chronic pain or athletes that want to get better faster. So, yeah, happy to answer any questions about it.
Going back to the kind of how Leo does with our, E&I services. So that's our cash base. It's an absolute slam dunk when I do my diagnostics. So our goal is evaluation. And if it's prime, they're going to do it on the first day. But if it's an evaluation, their very next visit is a follow-up. It's an EMG, it's an MSK. Right then and there, I find what's going on. So if I'm looking at a shoulder, I find a partial tear. I am prescribing to that patient. I'm telling them, next time you come in, we're going to start dry needling. We're going to dry needle under guidance of the MSK, and we're going to actually go right into the site. We're going to create growth factors. We're going to promote healing. You don't have to worry about surgery. When they come back in, that therapist doesn't have to do anything. They're already saying, oh, I'm doing the dry needling today. When I have that person come in on a shoulder and it's just inflammation, it's a ton of inflammation around the long head of the biceps. There's no tear. They can, they're totally relieved there's no tear in general, but I'm prescribing them. The next time they come in, they're going to be on the new fit system. Newbie's going to be on there. We're going to have it on an anti-inflammatory setting, and you're going to go through all of your exercise with that on. They come in, the therapist doesn't have to try and sell that service. It sells itself by me doing the diagnostic. Same way as Danica said, when I do an EMG, if it comes back clean, as we talked about earlier, why is it radiating from their neck all the way down their hand? And I'll find, is it the whole hand? Yeah, it's the whole hand. I had a person who had an MRI done, was going to have surgery. She came to us. I did EMG. It was completely normal. She did 4 sessions of dry needling and her hand came all the way back. Her strength was 25, 30% different, but she 4 sessions and her pain was gone just by targeting the myofascial and up in her upper trap. So we see this over and over and over, but it's again, slam dunk to get into our cash-based services, because once they know exactly what's going on with the diagnostics, they're just like, done, let's go. Yeah. Totally.
All of our innovative services during our PT sessions are 30 for the most part, and then 65 for dry needling. The other programs, so our Excel program, it's our recovery 30-minute session. That's $65. And then our AP session, our personal training session, is 30 minutes for $55 or $90 for an hour.
And also, if we do guided dry needling, it becomes $80. So to have the elite service to know target and it's actually interesting is once you mention it and the person's like, oh, that's $15. Yeah, let's do that because I want to know exactly where you're putting these things. So we got one question.
I don't really have a question here, but I just want to let you know that we are working in the fellowship with Danica, and the approach I love. We've actually had another therapist that has done it, and we are totally different what we're doing. The results we are seeing, and we just did upper back in December, and would be doing it next weekend, but it's too close to I can't get away 2 weekends in a row here. But guys, I mean, it's excellent program. I certainly recommend Danica and her teaching too. So, yeah, certainly consider it. If you haven't done dry needling and doing this, a great way to go.
Thank you, Roy. Thank you.
All right. Everybody get the code? Get the QR code? All right. Moving along. We're going to get into the heartbeat here. We're going to talk about our meeting rhythm. This is where the magic really starts to happen. These guys touched on it. This is straight out of the book Scaling Up by Vern Harnish, if any of you guys are familiar with that. That book is like drinking from a fire hose. So really, we are just talking about one little small part in one chapter about meeting rhythms. But again, something that we feel is so super important. So I'm going to start off with our annual strategic planning meeting. So if you guys aren't doing this, this is a great thing that we've done over the past couple of years. We take at least one day and we go off-site. So this is actually where you all were staying at the hotel. This is where we held our annual strategic planning this last year. And so this was just in December. And all of us, we utilize a facilitator. If you guys need my recommendation for an amazing facilitator, I can give that to you guys afterwards. But it's great because then myself especially and Joe, we both get to fully participate and be engaged in the strategic planning and not have to facilitate the session ourselves. And basically the goal at the end of that session is to have our 5 priority goals for the year. And of those 5 priority goals, who owns them and what's the measurable win? And that's what we kind of shared with you in the very beginning of when we broke down their roles. That's their priority goals for this year. So again, as CEO, I'm establishing that like macro foundation from the top. Like this is what we want to do this year, guys. And, through then leadership, I am going to take all of the things that John was telling us and try to empower these guys as much as I can to make that happen this year. Elena, you facilitate the quarterly town hall. So our next step from a meeting rhythm after we go yearly, now we're going to start to get a little more micro. And we're going to go into quarterly. We meet as an entire group, the entire team. We close the office for about 2 to 3 hours. And again, yeah, as the CEO or as the owner, you're like, oh, that makes me twitch a little bit. Like that's running into production. But at the same time, the connectedness, we eat together, we share together. Elena will go through kind of what some of that looks like. I believe that that's just so super important in our culture and empowering all of us to get to where we want to go. So do you mind touching on quarterly town hall?
So Danica and I are big Post Malone fans. So we've started playing Post Malone at the beginning of the last 2 quarterly town halls, just to get everyone in the right, just to get everyone in the right mindset. So yeah, as Angie said, our quarterly town hall, they occur 4 times a year. A lot of excitement is around this and just finding out where each of us are within our goals and how we're progressing. So everyone who is owning a certain thing, so pretty much all of us up here have one thing that we're focused on. And so we share that with the team and we give them targets. And so every quarterly town hall, we review everything that we've done so far and where we're projected to go and just kind of touch on, that piece of it on how we're doing, share some awesome wins along the way and try to highlight some of our team members. One of the things that we talked a lot about in good leadership is repetition, like consistency and all speaking the same language. So our core values, at the beginning of every quarterly town hall, we take some time and we have our team nominate someone who they can think of that represented one of our core values. So whether it was altruism or social responsibility, they just take that moment to highlight a team member, which, is just really great for collaboration and, just boosting morale at the beginning of our meeting. And again, we go through, we each have a little PowerPoint presentation that we do. And then we made Angie start. This was another change. We made Angie go last because she used to open them. But she obviously is so great with, her inspiring everybody that we were like, nobody wants to follow you anymore. So you're going to go last.
Yesterday, I need to speak last. So you were right on cue.
Yeah, I was like, let's go last. So then Angie comes through and she leads a great message that just inspires everybody, gets everybody really excited moving into the next quarter. And then we've also made another little change where we end, and of course we're all done treating for the day at this point. We're all going home. We all end on a beer, just to kind of celebrate the end of a quarter, the beginning of a new one, where we've come from versus where we're going. And the greatest thing is that, like, following a quarterly town hall, people come up to me and they're like, that was a really great meeting. Like, I feel really good. Like, I just get so many people just feeling really excited about where we're headed, and they really see the vision of Apex and what we're doing.
Yeah. So we started doing, some kind of lunch and learn type topic at our quarterly town halls because we found that between our two offices, it was difficult to really connect, over Zoom or FaceTime, however we were trying to connect. So we decided to do some live work together when we had the opportunity. So this picture is from when Joe and I taught MSK boot camp to all of our providers because, some of the new providers and even the students that I get, they think, I can't touch that. And I say, why not? You're just looking at anatomy. You don't have to have a license, certification, whatever, to touch this. My Ferrari is what I call it, my ultrasound unit. So, there is something special about, telling that new grad that, and then out of the corner of my eye, when I see one of them spot checking for a trochanteric bursitis, and I just get so happy. Yeah. So that's what dreams are made of right there.
And sometimes usually we end with a one-word close on how our meeting goes. But this was Joe's ending, this last one. That was completely, that was just like one of those moments, like.
That was Joe. I was going to go 1, 2, 3.
I know, we were like, what? Yeah, 1, 2. He's like, no, I got this. So that's quarterly. Meeting rhythm, monthly leadership, 30 minutes. We get together and we just go over where these guys report up to me. Where are you guys at on your priority? And they tell me, and we just make sure that there's no stucks, anything we got to get through, a little collective intelligence is shared, and then we move on. But it's just that good little, again, check-in accountability piece that everything's getting done. Then weekly, again, we also all meet and we talk about, we do all of the same things, like Elena said, consistency, our one-word opens, celebrate the wins, acknowledge each other and our team for core values. And then weekly, we look at, what is the stat? What's our condition? What are we all doing about it? And just so everybody, again, we have that communication that then they can, move down to the people that they're with. And then this is where I want you guys to really touch on. This is where the magic really happens from a production side of things. The weekly rounds and the daily huddles that these guys do are amazing. So.
Yeah. So every Monday, as the director of diagnostics, what I do is I go through every therapist's previous week and I screen all the evaluations. And then I use that to go back through and do individualized coaching. So that allows me to kind of identify, trends, well, this person was very productive last week, but, they missed 5 potential diagnostic referrals. So I utilize about an hour on Monday mornings reviewing between the two offices, usually around 60 evaluations. screening for diagnostics, and then being able to individually coach. Then we meet on Wednesdays, and Leo does the dirty work for me. And Leo's job is to look at length of stays, and that helps us to identify any outliers. So is this a patient that we need to help coach that provider in, well, did you do the diagnostic soon enough to be able to achieve our goal and length of stay with minimizing the number of visits that patient needed to get better? Are you utilizing the best innovative technology to help that person get better faster? Are they ready to graduate and be a part of our athletic performance division? Is this a chronic condition that we need to be able to tell the patient, you can't come to therapy forever, but we have a solution for you. We have an Excel program, and we don't want to ever discharge you. We want you to know that you can always come back here. We want to be your first point of contact. So we utilize these huddles to go through individually and kind of speak specifically more of the newer graduates on any stucks that they might have and help them kind of put together a strategy for best treatment.
And I'll also add at the beginning of those meetings, we go through and have everyone do a professional or personal win within the last 30 days. And it's really cool when they give a personal win because it just makes you feel connected with that person. Like, I just bought a house, or, you know, we finally got a venue for our wedding, or yeah, I just got a new dog. Like, these little things just make you feel connected with your team. And we also, when it's the professional win, like, this is where the diagnostics piece comes in a lot, because our therapists are super excited to share, especially with you. Like, I had an awesome diagnostic win. Like, I had a patient coming in and they'll just light up talking about it. And it's just infectious, because then somebody else will be like, actually, I had a really good one too. And it just reinforces why we're doing what we're doing. Before we even get into anything else, like, that's our starting point, to get everybody, you know, on the same page and in a good mindset.
Do you want to add anything to the weekly, Leo?
With our weekly rounds, that's been one of our greatest wins with transitioning our people to our AP program. We've been, the past 4 weeks, each week we've gained about 10 visits, 10 sessions for personal training a week. Every month we do a whole new set of rounds, and we keep track of that every single week. And with the idea of making that list a little bit smaller and smaller, so we can really pinpoint the ones that we need to focus on to transition. That's been pretty pivotal.
And we've got daily huddles all the way down to the very micro of every day, having that touch point.
Yep. Daily huddles occur every day with everybody in the clinic. We do it at the end of our lunch break. So we just take the last 5 minutes. I'm the one that's leading the huddle in both offices. So whether I'm over FaceTime or if I'm in person, I go between the two offices every other day. So I kind of get my fair share. It allows me to feel connected with everybody and make sure that I'm on the same page. We talk about the number of lives changed that each therapist has, and I'll make a point to note that this is also a little bit of strategy in this, that when we go around, I don't want to just know how many patients are you treating this week. I want to know, like, the question I'll say is, Leo, how many lives do you get to change this week, as opposed to how many people are you seeing? Again, it's the repetitiveness, it's the reinforcement of our purpose, which is to change lives and challenge the status quo. So being able to go around the team and say, how many lives are you changing today? And, you know, that has been a really great pivot for us, and just reinforcing why we're doing what we're doing. Everybody has one stat that they report on during this time. It's something that we go through pretty quickly. And then I will report on any, like, flashing red lights, like, hey guys, our cancel rate is really crazy. This is my strategy that I want you guys to really focus on today. This is what I want to look at. This is what I need you guys to do today. So that changes from day to day. We also have a rock star at the end of every single huddle. So really quick, I just ask for a rock star. That can be somebody who just went above and beyond that day, or who just knocked it out of the park, or who really helped collaborate in some way, or really helped out by taking an extra patient when someone was running behind, like whatever that might be, somebody gets nominated for that rock star in each of the offices. And yeah, we celebrate any wins from our front office team or from our therapist. So it just gets us all in the right mindset to go into the afternoon, and just the consistency of doing it throughout the week has really helped our stats as well.
So in the daily huddles that Elena conducts, it's not just the clinical team that takes part of that too. So every role within our practice, they have a stat that they're accountable to. So our clinic concierge, our front desk, or our exercise specialists, they all report on a stat too. So every role is very well defined, and they all have their one thing that they report on. So if you're not including your front office team, or your authorizations, or your new patient coordinator, then I'd suggest highly making them involved and be part of that team, because it's detrimental to your practice.
So at the very beginning, when we talked about like the traditional leadership and then the emerging styles of leadership, one of the last points on there was that the traditional leadership was very much the boss-like tone, right? And the emerging style of leadership is leaning into authenticity and just kind of just being one's human self in that role. So you guys are in for a treat here. I'm going to share with you an authentic video that I found that Joe and I created at our very first time that Joe went to learn MSK ultrasound in New York with Mohini. And I went with because I thought, if he's doing it, I'm doing it. I got through one of the upper extremity courses and I was like, oh, hell, I can't do this too. So this is Joe and I's video. And this is our attempt at utilizing the course to make social media. This was 2018, guys. So just watch. Just watch. You're in for a treat. You mean seriously? Don't tell me you guys can't do social media. This is where we started. This is where we started. So, my point is, really quickly to wrap up here, I really, really want us to all capitalize on the attention that is social media and what we are doing to pioneer primary care physical therapy, especially with the focus of diagnostics. This is from Forbes, just released in January of 2024. You can see by the millions or billions, I don't even know what this is, millions, of social media active users. Facebook, YouTube, WhatsApp, Instagram, those are the big ones there. Average person spends 145 minutes on social every day. The most engaging type of content is short form video, typically less than a minute. This captured the attention of 66% of consumers and was 2.5 more times engaging than longer video. If you guys don't know what to do with your content, you make short videos, 1 minute or less. 90% of those millions of people that were on social media follow at least one brand. About establishing yourselves as a brand for them to follow, right? And 76% of social media users have purchased something they've seen or they saw on social media. Guys, that's huge. It's huge. If you're not doing social with the little click link on the top, click here to schedule, link here for an appointment, or what if you guys do free assessment or free consultation or whatever it is. This is the behavior of now. This is where it gets interesting, guys. Percentage of each age group that uses at least one social media site. You can see the age groups here. So two things. We can think about this. We can think about this from a recruitment standpoint in who do we want to see? Think about who that unique selling proposition is geared towards. For here at Apex, it's athletes. Our biggest athlete range that's going to come in and see us and is going to pay for our prime services is right here. Look at our 18 to 29-year-olds. 84% of them are on social, guys. Who are we trying to recruit here? Our PTs, right?
Is it LinkedIn or not? What you say was the best for that young group?
Instagram.
Instagram.
Yeah. Would you agree, Alexis? Yeah. So here's the bottom line from that article. It says social media is about more than just apps and platforms. It is a digital environment that's clearly reshaping the world of marketing. Boom, 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 boom. Your brand can truly connect, engage, and grow with your audience. Embracing the evolution of social media and watch your brand story unfold in captivating ways. So again, you guys, it's not about, I'm just going to throw up some marketing on social and see what sticks. I'm just going to throw an ad up there. This is a way that we engage with our audience. This is a way that we engage with therapists we want to recruit. Tag them. When you tag them, it shows up in their feed. You're doing something about MSK, something in the clinic. Follow and tag. Follow and tag the University Rehab Sciences program. We have our local university. When we post things about MSK, we post things that are super cool like that. Tag. It shows up in their feed. They have to look at it and see it. Well, they don't have to, but they're going to because it's in their feed. They're going to see it. When I go on with two purposes. One, I'll post some of our own content. Two, I'll scroll through quickly just to find people that I know are in our tribe, and I'll like and engage on their post. Hitting a heart and making a comment on their post, you guys, is probably, I would say, has just as much value as me seeing them in the gym and giving them a high five. They see, it's an engagement platform. It is like the modern day dinner party. Yeah. So the last two hires that we've actually made from physical therapists are Ben. He was in, well, this is really cool. Ben was in Kentucky with a practice that was, they were trialing NewFit. And so as a new grad, or he was in his last rotation, he got to work with this with his CI and was like, oh my gosh, I can make immediate changes like this with my patients. This is really cool. I mean, think about it. When we were new grads, like, could have never made those type of changes with I didn't even know what I was doing. I can make a change like this with a patient. Holy cow. So he started looking and was like, I need to go work someplace that has a NewFit. Then his CI happened to see a post that we did about our truck. And his CI said to him, Ben, you should do something like that. That's really cool. So he started following us. And then he saw we had NewFit. And then we fought with Jason Waz, and Danica convinced him that the Children's Hospital here, where his wife would be working as a nurse, is much safer than the one in Tampa. And she used to work in Tampa, so it's valid. And so here we have Ben, and he is just a rock star. And then we just are bringing on a new therapist, Dylan, who he will start next month. He follows us on social and said to me during his interview, you guys don't do normal PT. He said those words. And I was like, talk to me about that. What is normal PT, and what do you see that I don't do? And he was able. I have this ultrasound machine. You guys have these things that your patients are hooked up. Like, then the whole reason why I got to talk to him was because our website wasn't working, and he hit me up on LinkedIn and said, "Hey, I tried to submit my resume to your website, but it wouldn't let it go through. So I just thought I would give you a quick, message on LinkedIn." The power of that, you guys. And we're trying to find therapists. Like, dang. So everybody's social media handle on the whiteboard. Everybody's LinkedIn. We all need to follow and share and tag. And again, just for all of us, for the bigger picture, right? Create more and more. This is how I create a lot of social. This is Alexis. He just does this. He just walks around and does this. And then he creates some really, really cool things that you guys see us post with these videos, these 1-minute videos that we do and all of that stuff. So do I think it's worth paying somebody extra to walk around and do this? 100%. So that's it. That's all we have for you guys. If you guys have any questions, we're happy to answer collectively or as a group, however that goes.
We have them scheduled once a month, and they're all posted on the HODS website, but lower extremity is next weekend. All right. And you can look at March. Sure.
I'm so proud of these guys and about the collaboration with Hands-On Seminars on this program, because this is the only fellowship program in dry needling. This is not just, it doesn't take you only through just learning how to perform dry needling in a reimagined way, but also at the completion of that educational component, it has attached a fellowship part where you are going to treat patients, send in the methods that you treated the patient, pictures, results. There is like various things that you have to send into Danica, and challenges also in the treatment. And she guides you through then that, okay, thumbs up, good job, or maybe you could have done this, maybe you could have done that. So in dry needling, guys, as it is important how you are going to do something, it is even more important where you are going to do it. The location where you are going to put the needles, it is so paramount. I have seen time and time again people having some radiating pain in their forearm area, and I see dry needling therapists sticking needles in the brachioradialis. The moment that this all came up from the scalenus muscles, that they were supposed, the SCM, that they were supposed to be treated. It is so important how you will select the proper muscles to treat, and then to utilize a very effective way to treat them. So you guys are doing an amazing job on this. So very well done.
Yeah. I will say too, like I said, we've been with them since December. Danica is always a resource. But we email, text, whatever. If I have an issue in doing, and then she makes suggestions. Oh, well, why don't you do this? Because I'll be honest, as Angie and I were talking, we've only done upper, but I've already done backs, and I've done some lower stuff right there, but with some coaching. Yes, I know I've been rogue. That's what Swathi, my other therapist, who has not gone that far. But yeah, Danica is a great resource when you're not here as well.
That's the biggest difference is, you go to these weekend courses, and, it happened to me too. I went and took the course, and then I had a question. Wait a minute. Someone's on an anticoagulant. What do I do? Crickets. So that's not helpful. So I'm happy to be here as a resource for all the, I don't know, collective millions of people that we've dry needled here at Apex. So happy to be here and of service.
Guys, round of applause again for Apex. Thank you so much for hosting. This has been an amazing, amazing leadership conference. I can't tell you. I'm kind of going back to Apex for a minute. I think all of us at heart for the last several years, having been able to rub shoulders with Angie and Joe, we're all kind of Apex wannabes. Come on, we are, right? Yeah, absolutely. So in this, we've taken in a lot today, and the last couple of days, guys. I don't know if you find the biggest barrier after having gone to an amazing event like what we've been a part of for the last 2 days. For me, it's always implementation. How do I take that home? How do I put it into practice? We've got some months ahead of us. The great thing is we've got a great team, right? Because the brilliant opportunity that HODS gives us, being a part of really, being a HODS franchise owner, is not only the wonderful opportunity that the education yields, being able to optimize outcomes through diagnostics for our patients, but the collaborative effort that comes through being able to rub shoulders with such an incredible network. Because I know tomorrow when I've got a question and I'm up against Blue Cross of Idaho yet again being shut down because I'm only a PT and we don't talk to PTs, I'm going to get Tony on the line, and he's going to answer some questions and give me that encouragement. If I've got a problem with recruiting, which we all do, I'm going to call Ron and say, hey, I need that PowerPoint. And Ron's going to be like, oh, great. End of day, I'm going to shoot this over to you so that you're ready to go with University of Utah for next week. Okay, I think we could go through all the topics and know that we're all here for each other. We are stronger together than we're all going to be separately for sure. And building tomorrow is what we're all about today. So we're gonna hit a one-word close, and I'm sure we're gonna be kind of hanging out in your space here, or at least some of us, for a few more hours. So we thank you guys.
And they're welcome to hang out here.
And for all those, myself included, that didn't get the polar plunge, perhaps there's round 2 happening later. All those. But let's let the mic go at this point. Before we do that, though, again, Kostas, Craig, Dimi, thank you guys. I know we want to be leaders within our own right and visionary and be able to do that through perhaps a different leadership mode and method than what we've had in the past, right? We've perhaps, in my own way and standing in my own corner, I've been a little bit too top-down heavy and less visionary. And I think I've got some ways to grow and change. But the great things that you guys have exemplified in the way that you lead HODS is trying to bring all of us along with you, right? That's the method. That's the mode. And I can't tell you, well, quick little side story. I think I did MSKUS in the PT practice for almost 2 years. Honestly, was ready to give it up and was talking to Mohini one day, and she said, Bart, I think we may have mentioned this in the first 5 seconds of upper extremity, but are you doing 5 a week? Because I was expressing some frustration, right? And I said, oh, actually, I'm not. I'm doing about 5 a month. And she said, I'm going to point you back to that reps make all the difference. You're never going to become proficient or a leader by not acting. So just encourage you to act. And by making that one change, it's become, I've made all kinds of weird statements over the years. I'm going to stick to them. Never going to treat a shoulder again without an ultrasound. I'm never going to treat a knee again without looking underneath. I can't do it. I can't do it. Just can't do it. And when it comes to EDX, it is really the pinnacle of all peripheral nerve and spine. It is where we all should be. And so as we close our conference, this is the beginning of the work. We know that. And we've got some really phenomenal examples of how to not just go back and try to bite that off and do it alone. That doesn't work. I've tried it. Just doesn't work. That's not how we lead. We need to bring it back and really follow the examples of what HODS is integrated into our practice, within our practice, and be the leaders of tomorrow by bringing these back in, sitting down with the team and talking about how do we integrate, how do we lead, how do we grow. Anyway, thank you guys so much. We appreciate what you do, but we appreciate the way that you exemplify what we should do. Yeah, one word close. You know I'm coming to you, Leslie.
Full. Elated.
Howard.
Grateful.
Enriched.
Inspired.
Awesomely inspired.
Aligned.
Grateful.
Excited.
Renewed.
Superhero.
Is that one word?
For sure.
Excited.
Delighted.
Inspired.
Enthusiastic.
Inspired.
Well, before it was said, now let's go.
It's 2 words.
All right.
Elevated.
Pumped. Optimistic.
Implementation.
Okay. Education. Encouraged. Pumped.
Inspired rocked. Yes, that is one word.
Grateful.
Dare I say disrupted?
Thankful.
Family.
Giant.
Supported. Clear.
Ready.
Grateful.
Opportunity.
Grateful.
Don't put them. Gladiator.
I think my one word is future. I definitely see a brighter future every time I'm with this group. So talking about the future, just a couple of things, guys. And Dimi, do you have any closing things that you would like to? I just want to remind about symposium, right?
Symposium November 1st through the 3rd in San Antonio. Leadership first weekend of March 2025 in Kentucky. You're going to get from the leader from the Business Advisory Board invites to join functions in the HAT Business Advisory Board, and very soon we'll get the study going. And anybody who's going to CSM, let's get together there.
Fantastic. So on your way out today, I need a commitment, right? You would think it would be about all the things that we've just announced. We definitely need that commitment. But there's one more commitment. Joanne's going to be taking on a little sign-up sheet that she's putting together on the corner. We need you to write your name down, and we need you to write down the DPT programs that you're going to cover. Okay. So as the business advisory board, we were talking the other night about a state that basically some of their academic people that they're running their state version of APTA in this state. I don't even want to say the state. It makes me nauseated. Came out with a statement, said that we don't do MSKUS as physical therapists in this state because, and their whole rationale was because, again, our students are not being educated or having exposure to MSKUS. So we have decided in our practice act that in our state, physical therapists don't do this.
Oh, wow.
So this is something that now is going to take quite a bit of effort to reverse and to change. So action is going to have to happen now. In our states, we've got to be aware of what's going on. But to turn the tide on that, we have a lot of academic, wonderful people, bless their hearts, that are not quite as cutting edge as the people that are sitting in this room. And they are making decisions for us. So being aware is one thing. Teaching exposure courses that HODS has and within this group collectively has already created for us. That's the challenge. And so on your way out today, if you just write your name down and which university groups that you're willing to or already have started to work with, but even just willing to, we're going to try to, as the business advisory board, make that change today. Okay? I know it takes sacrifice on all of our efforts to be able to reach out to these students, but if we're really going to put our effort where we just talked about, and we got to open up Instagram, obviously. I'm making that change. But I've got to put, I can do this. There's some changes I need to act, right? And I've got that on the very, very top of my to-do list. But if you can write down your action today for these new grads, for these BPT students. I've had some wonderful experience at this last year at University of Connecticut. They are not in my backyard. I'm in Idaho, but I've made it to UConn, at Idaho State University, at Rocky Mountain University, at Provo College, at Brigham Young University, Idaho. It's a little bit of time, but we're really talking about an hour here, an hour there, semi-annually, quarterly, once a year, whatever that takes. Anyway, that's the little plug from the Business Advisory Board. Two other action items. We've got AAMU has a virtual conference coming up in March. I believe it's March 23rd, if I'm not mistaken. Am I correct? Someone's going to validate that. And then Rocky Mountain University does have their EMG symposium coming up 23rd and 24th in Utah. So we've got incredible opportunities for continued learning and growth and development and engaging, obviously, in the diagnostic fight. Thank you all. Thank you all for coming. And thank you again, HODS.
Wow, these were some kind of shares that really, if you put them in clinical practice, those tips, those ideas, it can make a real great difference for your clinical practice. So this is the end of another episode of Precision in Clinical Practice. I hope you learned a lot and see you all next week. Have a great week, everyone.